Assalamu alaikum warahmatullah. Our talk today about infraction. Infraction or an infarct is an area of ischemic necrosis caused by occlusion of either the arterial supply or the venous drainage in a particular tissue. Okay. Etiology: either thrombosis or embolism that constitute 99% of the causes, or venous outflow obstruction, single outflow organs like the testis and the ovary, or others like hypotension, vasospasm, compression of vessel by hematoma or tumor, and twisting of the vessels. Cessation of the blood supply. That's mean, okay? Cessation of the blood supply by the occlusion of the artery or the occlusion of the venous drainage in the particular tissue. The morphological classification of infarcts can be classified according to the morphology. For pale or anemic white, when the area of the necrosis colored pale, or red hemorrhagic infarct, or septic or blunt. Okay. Pale white infarct. This occurs when the solid organs with end arterial circulation, such as kidney, heart, spleen, give us wedge-shaped. Okay, at the end of the occlusion, at the site of the necrosis, there is wedge-shaped of the area. Okay. Microscopy: there is coagulative necrosis in most organs. We said before the coagulative necrosis in solid organs. In the brain, there is liquefactive necrosis because of abundance of the water in the brain. Inflammation in response to there is inflammation in response to necrosis. There is phagocytosis of cellular debris by neutrophil and macrophage. There is healing response and scar tissue formation. All these can be seen under the microscope. Okay. Infarction can be white. They occur when there is arterial occlusion in the solid organs or compact organs. If there is few collateral circulation, like in spleen, kidney, heart, or the brain. Morphology: gross, dull, pale, dry, wedge-shaped necrotic lesion, a hemorrhagic zone surrounding. The area of the infected will be white, pale, but the surrounding zone can be hemorrhagic. This in the kidney, for the example. Observe the wedge-shaped like the triangle. This the picture of the. Observe the pale color and the hemorrhagic around the infected, the necrotic area, or around the infected area. This infection in the spleen. Observe the arrow. This infection in the cardiac muscle. Brain infection قلنا عبارة عن liquefactive necrosis. Observe the area of this pillar. Okay. Observe the liquefaction, this white area, the right picture. Red hemorrhagic infarct. This usually occurs when there is venous occlusion of organ with single venous outflow, like in the testicular torsion, or in the loose tissue like the lung, spongy tissue, or tissues with dual circulation, lung and gut, with reperfusion of previously infected tissue. The infected tissue, there is reperfusion of this area and give this red or hemorrhagic infarct. Like the observe the picture in the left. This is the lung. Observe this red hemorrhagic wedge shaped. Okay, because in the lung is hemorrhagic. But the picture B on the right, this spleen with end arterial occlusion, this pale area, this the infected area, not infected, infected area. Okay. This hemorrhagic in the intestine because there is collaterals and dual circulation, dual blood supply give this hemorrhagic red area of the intestine. Pulmonary infarct, ischemic necrosis of the lung parenchyma following pulmonary embolism and lack of blood from bronchial arteries can occur when blood from bronchial arteries reperfuse the ischemic area. Blood leaks into the alveolar space and give this hemorrhagic area like in the previous picture. Septic infarct following fragmentation of bacterial vegetation from heart valve or following microbes seeding a necrotic